A healthy life starts when we're young, and having the right kind of medical care is the foundation to becoming a strong adult. So throughout the show, we're going to share with you incredible specialty care offered at Providence Swedish. So join us as we spend the next hour exploring the pediatric services that save lives. New Day starts now.
It's a new day.
Now from King 5 Studios in downtown Seattle, this is a special presentation of New Day Northwest, sponsored by Providence Swedish. Here's Amity Adrisi.
Good morning, my friends, and thank you for joining us for this special presentation of New Day Northwest, sponsored by Providence Swedish. Now, during our show, we're going to explore the many life-saving services that Swedish pediatric doctors, nurses, and specialists provide to kids every single day. My kid included. In fact, my son's very first experience at Providence Swedish was happening on the day he was born. That's right. Look at that guy. He's gigantic. Does he even look like a newborn to you? He was 9 pounds, and because of his size and my size, labor was hard and at times very scary. He was in fetal distress at one point, which put me in like maternal stress. And all the doctors and nurses, though, they were incredible. They made me feel like everything was it was going to be okay. And it was. After many hours of labor and maybe a few choice words, the incredible labor and delivery team at Swedish helped me give birth to this beautiful, healthy baby boy. Isn't he the cutest? But the birth of our lives is just the start of our health journey. And that is why we are so excited today that we get to spend the next hour talking about the importance of our children's health and the unique specialty services available should your child ever need them. And really, I could not think of a better guest to kick off this special hour than Dr. Elizabeth Mead, Medical Director of Education, Outreach, and Quality. Now, whether you're new to parenting or not, this is the person you want to have at your back. Dr. Mead, as a journalist, you have been my go-to for so many questions about children's health. So we're so glad to have you here as one of the many incredible pediatricians coming from Swedish. So
thank you for having me.
It is always a pleasure to see you. So let's just start first with kind of give us an overall glimpse at the pediatric program at Providence Swedish.
Oh, sure. So I had both of my kids at Swedish as well. And I think one of the unique things that really sets us apart is that we kind of do that care all the way from birth up through pediatric life till you turn 18 and then even afterwards as an adult, right? And so we certainly have a very robust labor and delivery birth program. Tons of people give birth at Swedish. We also have a lot of pediatric programs should your child need additional care after they're born.
Which is so important.
So we have a level 4 neonatal ICU, one of the only ones in the state that can provide really state-of-the-art care if your baby needs NICU services after they're born. We also have a pediatric inpatient unit if your child needs to be hospitalized, and that can be anywhere from after they're discharged from birth up until the age of 18. We have a pediatric ICU, and then we have lots of pediatric specialty doctors, so surgical specialists and medical specialists, as well as services like pediatric therapy and child life and all sorts of things to really kind of round out the medical care.
So comprehensive.
Yeah.
So many things. Let's talk about inpatient services. So my son might have to come in and get his tonsils taken out. And I'm really nervous about that whole process.
Yep.
So what are some of the common fears or concerns that parents like me have when their child is hospitalized?
I think for any of us that's a parent, primary is always, is my child going to be okay, right? But once that's answered, I think people do tend to have some secondary questions and concerns. And so one of those often is my child going to be in pain? Are they going to be scared? Are they going to be in distress?
Yeah.
So we have lots of things we do to try to mitigate that. Certainly medications can be helpful for pain and those sorts of things. But we also have a lot of services like our child life specialists that really are devoted just to kind of developmentally appropriate behavioral and emotional caregiving for the kids that are hospitalized. So lots of things like distractions and fun activities and different activities that we can do to really make sure kids are as comfortable as possible.
Yeah.
And then I think parents also want to know, will I be able to stay with my child? And the answer is almost always yes.
Okay.
So with the exception of our NICU, every room that we have is an independent room, so there's only one patient. Both parents can stay if they want to stay 24 hours a day.
Yeah.
We really want your child to feel as safe and as comfortable as they can.
I've actually seen the rooms where the babies, if they have to stay longer, there's like a bed for the parents. Like I've been in there and it's very comfortable and it's very nice. Luckily, it hasn't been for me personally, but as a parent, who should I expect to see on my child's care team? Like who's part of that team?
Well, it's a big team, so I think that can also feel a little bit intimidating for people if you don't really know what to expect. So I think it's a great question.
Okay.
Certainly you'll have your child's kind of primary doctor. That's the one who's responsible for all of their care and coordinating that care. You'll have a nurse who's really dedicated to your child, and that's called your bedside nurse, so you'll meet that person. And then we have charge nurses and other nurses that kind of help out, that may be floating around and taking care of your child as well. If they need a pediatric specialist, like a surgeon or another doctor, they'll meet them. And then, like I mentioned, some of those other services like Child Life, we have dietitians, we have lots of other folks, pediatric therapy team, who may come in and interact with your child as well. But the way that we do rounds at Swedish is we do what's called family-centered rounds.
Okay.
So each morning, the whole team walks around the unit and sees every patient and family face-to-face to make sure they can really get all of their questions answered with everybody there, so they're not having to repeat the same questions every hour, which I think any of us who have been in the hospital know can happen sometimes.
You're like, yes, it's this, no, it's this. Okay,
Yeah.
That's awesome. I've always wondered this as well. Is there a difference in training or knowledge with hospital-based doctors compared to, your clinic doctors?
Yeah, it's a great question. So generally, yes, it depends a little bit on which specialty. Every pediatric doctor has a foundational training in pediatrics. So that's several years of training just in seeing kids, again, birth to 18. But then our specialists and our NICU doctors and our pediatric ICU doctors do additional years of training just in that discipline. So that's really focused training in whatever unit they're working in. And they have really, really specialized advanced training in how to care for kids that are acutely ill, for example.
Yeah, and that's so important. And that's kind of the reassurance you really want to have when you're in that moment.
Absolutely.
It's
right. You want the most
terrifying.
experienced person to be there for sure.
Right. So what can parents do on our side to help kids cope with an illness or, let's say, a hospital stay?
I think kids really want to know what to expect. And sometimes we don't do a great job at being super honest with them because we want to protect them. But I think our team is really good at helping parents understand, well, what's the kind of developmental or age appropriate way that we can be honest with the child about what's happening and tell them what to expect, tell them what's happening, tell them what's going to happen so they're not surprised. I think it's really a disservice to kids when we say it's not going to hurt and then we do something that hurts, or we tell them it's going to be fine and then they're going through something. So I think we're as honest as we can be in a way, again, that's sort of developmentally appropriate. And then again, as much distraction as we can have. So lots of activities, walking the hallways, having people come and visit. Therapy dogs. We have therapy dogs that come and visit the kids. So there's all these things that we do to try to make it more comfortable. But then I would say too, if you as a parent, you know your child the best. So if there's something that you think would particularly make your child more comfortable or feel safer, please tell that to the team. We really want to take individual care of each patient and make sure we're doing everything we can to really address their individual needs.
Yeah, I think the iPad would just...
I mean, all rules go out the window, first of all, when you're hospitalized. So it's screen time, it's juice, it's popsicles, it's like all these things we try not to do as parents. The rules go out the window. We want to just make it as safe and fun a place as it can be.
That's such a really good, important thing to do. I've always been grateful for how well all the departments at Swedish work together. So how does the team of specialists collaborate with, let's say, the primary care physician where that everything starts?
I think this is one of our greatest strengths, and I really think it's one of the reasons I came to Swedish and that I've stayed at Swedish. It's such a tight-knit team of people. The communication between specialties, between hospital doctors and outpatient doctors is excellent. So we will tell your child's primary care provider when they're admitted to the hospital. We'll tell them when they go home. We'll send them the notes in between. And then there's lots of communicating via our electronic health record or phone if someone's not on that system to make sure that your child's provider knows what's going on so that you don't have to, again, reinvent the wheel when you go to follow up with them after discharge. That's one of the things that I think is most important is that line of communication so that the care is really seamless after you're well enough to go home.
Yeah. Speaking of the online communication, there's an app now. I just got alerted and I downloaded it and it's so easy to use.
That's right. Yeah, we try to really work on that because I think it's one of the barriers for people to feeling like they can get timely care is just being able to communicate well with their providers.
And their providers responding, which is really, really helpful. What sets Swedish apart as a place to see children?
It's a really interesting and wonderful dynamic there, again, because you can be born there, you can get all of your pediatric care there, and then you can continue to get care in that system after you're an adult. And so I think that's one of the things that really is special for us, is that ability to care for someone throughout their entire lifetime. From that birth process, which so many people have at Swedish, should your child, hopefully not, but should they need any kind of specialty care, that can be had there. And then we can really seamlessly transition them to adult specialists. So some of our kids with chronic diseases, for example, we're all in the same system, and so it's very easy for us to transition that care, make sure there's great communication again, and that it's a comfortable and safe place, and it's not scary or intimidating for that child to then transition to a new set of doctors.
It's so true. Like my son has a pediatric endocrinologist, and that's something that like I wouldn't know where to find the next step when he does turn 18.
Right.
And that's just something that was easily done at Swedish?
Yes, and I think it's something people don't think about. And so sometimes, you know, your kid then gets to be a later teenager or they're all going to college and you're thinking, well, oh my gosh, where are they going to get their care, right? Maybe they're moving to a different city, but if they're staying in the same place within our system, we really can have that smooth transition of care. And I think because we are such a tight-knit team and we all work in the same physical space together, we know each other very well, the level of communication is just different. There's a lot of texting, there's a lot of going to see the patient together, there's a lot of let's all go in the room so that the family can understand that we're all on the same page, we're all thinking the same thing. Because I think sometimes the other problem is when we're in the hospital, we hear a lot of different opinions, and it's hard to make sense of sort of what's actually going on.
Yeah, no, that's so true. My last question before I let you go, where do Swedish pediatric specialists see kids? Is it at First Hill?
And other places, yeah. So
Okay.
our main campus is at First Hill, so all of our pediatric specialists see kids there. But then we also really try to get out in the community and meet people where they are, because I know it's a huge burden for people to have to travel to appointments as well. So many of our specialists go to Swedish Issaquah and also to Swedish Mill Creek up north to really try to get to people's communities, make it easier for them to access care, and just less of a burden to get to so many appointments.
That's huge.
Yeah.
It was so good to chat with you. It's so good to see you. Thank you very much for
Nice to
sharing
see
all
you.
this today. And to learn more about Swedish Pediatrics and what they offer for your family, just go to the website you see right there on your screen. Well, we are just getting started with this special hour of New Day. Later in the show, we are checking in with one of the youngest members of the Sounders to see what's important to keep in mind for young athletes. But up next, it may look like play, but the pediatric therapy team is serious about helping your child move better and improve their quality of life. I'm checking out the therapy centers after this. Welcome back to New Day Northwest. If you are a parent or caregiver of a child with special needs, you know that pediatric therapy is vital. From physical and occupational therapists to speech language, the bond between the provider, child, and their parent is crucial. Occupational therapist Ashley Langford joins me now. Thank you for being here.
Thank you for having me.
And thank you for what you do every day. My first question is, tell me what pediatric therapy services are and what your specialty is.
Of course. Well, I'm super excited to be here. I love my job. I am, as you said, an occupational therapist. If you don't know what that is, you are in good company. An occupational therapist, when it comes to the pediatric population, essentially just helps kids do what they need to do in their everyday lives.
Okay.
That can look like playing, eating, interacting with peers, going to school, whatever it might be.
Yeah.
And of course, looking at the underlying factors that are making that hard, like visual motor integration, fine motor skills, social skills, whatever it might be.
Okay.
Our team is multidisciplinary, so we have PT and speech as well. Physical therapists really dive into the gross motor, so think crawling as a baby, walking, of course with those older kids, running, jumping, climbing on the playground, and speech, of course, speech and language, but they do so much more than that. Also cognition, swallowing, feeding, we really cover it all.
I really had no idea how many specialties there were. A friend of mine's son has apraxia, and so they've been working with a speech therapist for
that's
years
great.
because it does affect the ways. And it's so hard for parents, like you don't always know how it's diagnosed, right?
Totally.
And that's where y'all come in.
Absolutely. We really try to support parents and the whole family unit, right?
Yeah.
I mean, it's kids. We have to include the caregivers to have
Yeah.
a successful therapeutic relationship.
Absolutely. Okay,
Yeah.
so what ages are we talking here? Because I'm seeing like a tiny baby helmet. What are the ages?
Yes, we work with infants and young children. So we see a super wide variety of diagnoses and children. We actually have a NICU follow-up clinic. That's what's special about our clinic.
Wow.
Is we get to support the continuum of care.
Yeah.
So we are an outpatient clinic, but we communicate directly with the inpatient team. So NICU babes that are in our NICU, when they transition home, we can help with that transition.
And you check and make sure everything is going right.
Exactly.
That has
Yep.
got to be a huge weight off of so
Yes.
many new moms and dads and parents overall.
Exactly. Yep.
So let's talk about what therapy specifically looks like at Swedish. Like, what do the services look like?
Totally. It would, of course, depend on the child, the age. Oh, yep, here you can see our beautiful pictures. I mean, we're working with kids, so we want to make it fun.
And pretty and light and colorful.
Exactly. This is our motor gym. We also have a sensory gym. We even have a ball pit that is a fan favorite of the kids, as you would imagine.
I would imagine.
Just a plethora of resources to tackle those fine motor skills, gross motor skills, cognition, speech and language, whatever's going on with the kiddo.
If somebody is at home right now and says, you know what, I've always had a concern, like I don't know what it is, what are some of the conditions that you treat, and how does a parent kind of know when it's time to contact their doctor?
Totally. We see a super wide range. Some of the common diagnoses might be children on the autism spectrum, cerebral palsy, neurological differences, developmental delays, even social delays or sensory processing challenges. So just everything under the sun. If parents are concerned about their child's development, of course, first step, you want to contact your pediatrician.
Right.
And then get an evaluation by a great team like ours.
Like you guys.
Yeah.
And so once you get to the clinic, there are all of these things that you use. And
Yes.
I think we've all seen some of these things, but I'd like you to take us through and show us
Of
what each thing
course.
is used for.
Totally. This just scratches the surface of all the fun stuff we have at our clinic. Let me tell you, couldn't bring the ball pit, so I'll have to. This here is called the Bailey. This is actually a standardized assessment for what we call NICU graduates.
Okay.
So when a child transitions from the NICU home, as I mentioned, we follow them for the first 24 months of life to see that they're meeting developmental milestones.
Okay.
And if they're not, we get in there right away and help the kiddo to catch up, help the family. The materials I would use would depend on the age of the kiddo. For example, for a 2-month corrected age infant, I might use this tool to look at visual tracking, cervical range of motion. For an older child, this has points, so we might look at the fine motor precision skills, following directions, that seated regulation. So it really depends on the kiddo. We have, of course, these puffs. Look at how we're manipulating one of those.
A child will do anything for one of those puffs.
Exactly. These come in handy.
And so this helmet, now what I've seen children, and I think everyone has out there with a child with a helmet, what is that for?
Yes, this is a cranial orthosis. So this is used in the NICU. Sometimes children can get plagiocephaly or flattening on one side of their head because they're really laying on their back quite a lot. A lot's going on, right?
Lots going on.
Lots going on.
Their skulls are soft.
Exactly. So this can help reshape that head if need be. This is an adorable little AFO or ankle foot orthoses. And these toys, of course, I mean, self-explanatory. We're trying to have fun, but we use these materials for therapy. Identifying pictures, if you're a speech therapist, turning the page as an OT, throwing the ball, looking at those gross motor skills.
And why would you have a baby doll?
Yeah, well, this very large, cute baby doll we use for demonstrations to parents.
Okay.
So maybe we're working with an infant and we have some exercises we want to do, but infant's asleep.
Yeah.
Well, we're not going to disturb that cutie. We'll use this to demonstrate to parents how do we do some of the stretches or the strengthening activities.
That's so smart.
Yeah.
Thank you so much for sharing all these wonderful things, for sharing what we can look for and see in our kids, and it really has been such a pleasure, and thank you for all that you do.
Of course. I love my job, so thanks for having me.
Of course, anytime. And you can learn more about what pediatric therapy at Providence Swedish offers by going to the website you see right there on your screen. Well, being a parent means that we do the best we can with all that life throws at us, right? When we come back, we've got advice from real moms about how to stay on track when it comes to kids' nutrition. Welcome back to New Day Northwest. You know, as we've been talking to all these incredible medical professionals throughout the show, it got us thinking about the parents' role in keeping our kids healthy at home, especially when it comes to nutrition. Now, I know we can't win every battle. Like nuggets and butter noodles are still a huge staple in my house, but we can at least try. Mom and producer extraordinaire Rebecca Perry joins me now. Hello, my friend.
Hello. You mean like choosing the restaurant based off of the macaroni and cheese because that's all they ever eat?
Oh, absolutely. Like we can't go there because they don't have the Kraft Mac style. But you actually said something yesterday in a meeting that I thought was just really simple and easy and smart. Limit the sugar and junk food by not keeping it in the house.
That's what someone told me. They're like, hey, if you don't want them to eat it, don't buy it.
Yeah.
Which is, hard because it's good.
Right.
And you want to have it.
I mean, but that really is it's an important thing.
Keep it out of the house. Just don't buy it.
And then I won't eat it too.
It's like a win-win.
They made me buy like red vines the other day, and why did I buy that? That's such a good point. You also meal plan, which I always thought that was really neat. That you try, at least you try to have like a menu out, and that kind of encourages them. Doesn't that help them eating healthier?
First off, it helps me when I'm like grocery shopping, and then it's like the school lunch menu. It's like they know what's coming up, and I think that there's some security in that a little bit. Like they can kind of prepare themselves for the meatloaf day that maybe they don't love, but
they know that that's what they're going to be eating.
That's what they know they're going to get. Yeah.
For me, it's about the healthy lunches at school because I don't know. My son likes to buy lunch at school, but then I don't know what he's eating. So I like to send them with a lunch. And it doesn't have to be like, just fruit and vegetables. I'll send them with seaweed sometimes, rice, because it's an energy device.
Yeah.
But those kinds of things. And they are resilient, right? They're gonna get through this phase of
They're gonna
nuggets.
get through it. At least that's what doctors have said. It's like, as long as they'll get through it. Try and sneak in, I love that you sneak in seaweed. That's pretty cool.
Yeah.
Like, try to find a couple of veggies or fruits, something that's nutritious.
My pediatrician also told me, though, that like if all they eat is Go-Gurt for a while, they're going to be okay, as long as they're getting food. We need to not freak out so much about it.
Protein is something that I've really been thinking about a lot lately. Like, how do I get the protein?
How do I get more?
Yeah.
I think that the other thing that we had talked about too are like lifetime habits. Like it's really important, and I don't do this enough, sitting down with the kids to have dinner.
Absolutely, yeah. And trust me, I am going through a phase of life where it's not possible every single day. But if you can, those days that everybody's at home, just do it.
Just do it.
Even if it's 15 minutes, just eat together as a family. It's not only you're going to eat healthier, but that mental health aspect, I think, is also really important.
Right, that chatting, that talking, and and modeling behavior too is such 100%. An important thing too.
Keep the phones away from the dinner table.
All right, no phones, just good food and good family. Yeah. Thanks for this chat.
Of course.
All right, well, speaking of healthy kids, playing sports offers kids so many benefits that extend far beyond the field. After the break, I'm chatting with a player from the Sounders about how exercise can strengthen a child's brain health, so don't go away.
Welcome back to this special presentation of New Day Northwest, sponsored by Providence Swedish.
Welcome back to the show, my friends. Part of being healthy is being active, and what is more active than playing soccer? So to learn about the power of the exercise, we went to the new world-class Sounders training facility in Renton. Check this out. It's the Sounders FC Providence Swedish Performance Center and Clubhouse, which just opened this past February. And let me tell y'all, it is a beauty. The facility includes a world-class gym with customized equipment, a treatment room, a player's lounge, and look, even a barber shop. So I recently had a chance to check it out and visit with Sounders midfielder Obed Vargas to talk all about brain health. Obed, thank you so much for showing me around this gorgeous facility, teaching me, all the tricks I'm going to use on the soccer field. Tell me about your training, if you would. What do you do to incorporate exercise that is not just physically challenging, but mentally challenging as well?
Well, on the field, we have a lot of things we can do. Training is obviously physically demanding, but once we get tired, that's where the mental component comes in. Focusing. When you're physically tired, your body's fatigued, but keep making sure that your mind is still focused. Soccer is a free-flowing game. It's always moving, it's always going. You don't have any breaks.
Yes.
So just being able to stay sharp once you're tired and, not losing, your focus is very important.
I gotta imagine that especially has helped that mental focus, those mental skills have actually impacted other areas of your life outside of sports, right?
Of course. For me, stress, school, relationships can all be mentally demanding. Some of the things that I've learned through the sport is how to deal with my teammates. All my teammates have different attitudes, have different personalities, and that's helped me off the field, as well as on the field. Another thing is adaptability, being able to adapt to different environments. We go, we travel a lot, whatever, we eat a lot of different types of food. It's just mentally knowing that it's not always going to be the same, and being able to adapt to that is crucial.
Yeah. What advice do you have for young athletes about integrating mental skills training with their physical training?
Honestly, I think mental training will get you a lot further than physical and on the field training, because there's always going to be talented players, always going to be great players, but I think what makes the difference is the mental aspect of the game.
That's such good advice.
Yeah.
I want to introduce you now to Dr. Jordan Orr. She works at Pediatric Sports Medicine
Hello.
at Providence Swedish. So glad to chat with you. I've got an incredible athlete, an incredible pediatric sports doctor, and I wanted to ask about when a child plays sports, how does it impact their brain development?
Yeah, so our brain's ability to adapt and learn new skills is improved through physical activity and exercise.
Really?
Yeah, specifically children who have a higher level of aerobic fitness have better working memory, attention, and they have improved response speeds. Yeah, so a lot of those things are improved through sport and exercise. Different parts of our brain actually remap and remodel to improve body awareness, and then also gain pathways that make it easier to learn skills faster and then retain them.
Oh my, that is really good to know as a mother of some young kids who do play sports, but maybe not enough aerobic activity. So are those like the only activities that help boost cognitive functions like concentration and decision making?
I would say maybe that's the most supported in the literature, but I think anything that gets your body moving that the kids enjoy, that they'll stick with, is much more important than something they're not gonna enjoy and they'll give up and end up sitting on the couch.
Yeah, like my college sport, which was badminton. You should play sometime, it's very fun. How does regular physical activity impact a young athlete's brain, their health, kind of the brain health in the long term?
Yeah, so we talked about like when they're learning a new sport, obviously they're learning new skills, but they're building those pathways in their brain to make it easier to learn skills in the future as well. There are other aspects of sport: communication, teamwork, time management, confidence, self-efficacy. All those things are gained through sport, physical activity. Other things that are affected: people who are more physically active sleep better. And when you sleep better, you cement the things you learned during the day, and then you're prepared and re-energized to learn the next day.
I have to ask you a bit. So what are some of your favorite exercises that boost mental and physical health?
On the field, we have some drills where literally there's no pressure, no opponent. It's just kind of going through the motions. And it might seem easy because you're just going through it, but the mental part that you're working on. So making sure, in soccer, your pass is correct, your technique is right, you're playing your teammate the right space. It's all just mentally demanding, making sure you're doing it right. There's no pressure, right? It seems easy, but it's the mental aspect that you're working.
It's mentally demanding. Will you show me?
I can show you later.
No, I'm just kidding. No, it's too late for me. But before I let you go, Doctor, what are some ways that youth coaches and trainers work exercises for the brain into training?
Yeah, I think some of the things that Obed mentioned are great, but just keep it engaging. Try not to put them in such of a stressful situation that they're not going to want to keep coming back. Because I really think that cardiovascular fitness is the huge part from a medical standpoint for brain development.
Thank you so much, both of you. It's been a pleasure chatting with you. You've taught me so much as a parent, and so much I hope for everyone out there who's really trying to get that cognitive activity working with that physical activity. Thanks, Obed. Let's go learn these. Let's go learn some of these. Thanks again to Obed and Dr. Orr for that important perspective. Because when it comes to taking care of our health, we hope, though, our children will follow all the things that they need to stay healthy. But more than anything, we hope that they never have to have surgery. However, if they do, Providence Swedish goes to great lengths to make sure families feel comfortable while they're at the hospital. Now, here to tell us more about how and what they do is pediatric surgeon Dr. Rob Weinsheimer from Providence Swedish. Thank you for being here.
Oh, thanks for having me.
So before I get into many of the questions, I wanted to ask, what are the most common types of surgeries you perform on children?
Yeah, so I'm a general pediatric and thoracic surgeon. So that basically means we do a really wide variety of surgery. And the most common things emergently would be appendectomies, so children with abdominal pain due to appendicitis. So that's number one for sure. for children coming in through the emergency department.
Okay.
And then for things that are more elective, that are kind of planned and scheduled, hernias would be the most common, but there's a broad range of things, from chest wall abnormalities to lumps and bumps to kind of you name it. So it's really broad, which is part of the rewarding part of the specialty.
To tonsil surgery, right?
Yeah, exactly,
I was
exactly.
mentioning that earlier.
Yeah.
But I'm excited that you actually brought some things with you, some sort of surgical instruments. What is all this, and what is it used for?
Yeah, so one of the exciting parts of the evolution of surgery has been a focus on really trying to decrease how invasive surgery is, right? And when it get down to it, it means trying to keep incisions really small so you don't have big scars. And not only is that great, from an appearance standpoint, but more importantly, it helps children heal faster.
Oh, yeah.
And so that means less pain, getting back to all your activities faster. So, lots of our older kids and teenagers are just really want to get back on that soccer field.
Oh, yeah.
And this is one of the keys to do it.
So what is this? And,
Yes.
and they just, I don't want to touch it.
Yes,
but
no,
may touch it.
you
Okay,
can.
so
You won't break it, yeah.
What are they? Are they just like tiny instruments and tools?
Yes, so a lot of surgery is done open, which is the traditional larger incision,
Yeah.
And then using tools in your hands and directly manipulating tissue. And then this is a technology called laparoscopic surgery. And yeah, I can show you what these instruments look like. And the cool thing is these instruments are designed specifically for children. And so when we have adult size instruments, they're 3 times as large, which means 3 times as large an incision. So these go through these little sort of straws, which are called trocars. And so the instrument goes through, and then we can manipulate. So this is at the level of the skin. The tip of the instrument's now the inside. And then we can do our surgery with usually at least 3 of these. So a camera through one, and then some instruments through the others. And so that what is amazing is the size of the incision then is just the diameter of that, which is just over 3 millimeters.
This is incredible to see. I can't even believe just how far technology has advanced and how wonderful it is that children have been thought of, especially in this manner. I imagine, though, that going into surgery, going to the hospital could be a scary place for kids. What does Providence Swedish do to make that hospital experience less intimidating for kids overall?
Yeah, so that is a huge thing. And we have clearly the patient, but we also have parents, right? And parents are feeling really stressed in this moment. And as much as we try and preempt that and ahead of time kind of go through the experience with parents and the child, at the day of surgery, we really have a team approach that is really focused on having kids relax and be calm and be stress-free. And so the very first person that they meet is a child life specialist. And I know Dr. Mead talked about that a little bit. And they are wonderful. So they really make the experience from walking into the doors to the hospital to going home a fun experience.
And I'm looking at some of the images that we have here, and there was a teddy bear with a mask on, just kind of letting kids know that, making it safe for them, right?
Yeah, so pretty much every time a child is having surgery, a stuffy is part of the experience, and it's great to just walk through, okay, here's a mask that goes on.
Yeah.
They get to pick out some great smells that they put on the mask that, is
neat.
lemonade or whatever flavor they want.
That's so clever.
So it's really fun. Yeah, they have a good time.
As a general surgeon, though, I imagine collaborating with your colleagues is important, that the pediatric, physician. Talk to me about how you work with your pediatric specialty care colleagues at Swedish.
Yeah, so that is a huge part of it. And that's honestly one of the best things about my job is I love the people I work with. And our specialty office is set up in a way that a family can come in and they can see a pediatric GI doctor and then stay right in the same room, and then myself or one of my 2 pediatric surgery colleagues will come in and see them for an issue that involves both medical care and potentially surgical care. So it's really collaborative. It's a kind of a very close-knit group, so it makes it really fun.
It makes all the difference. It really, really does. Thank you so much. It's been a pleasure chatting with you. Thank you for showing us these incredible instruments and what you do for kids every day. Thank you.
Yeah, you're so welcome.
All right, to learn more about the pediatric surgical options Providence Swedish has to offer, just visit the website you see right there on your screen. And when we come back, what we as parents can do to help protect our children from catching infectious diseases, the symptoms we all need to look out for when we come back. Welcome back to New Day Northwest. It is no secret that kids share a lot of germs, especially when they're at school or daycare. And while we'd like to avoid our kids getting sick from infectious diseases in the first place, it's really important for parents to know what symptoms to be on the lookout for. And here to help us with that is Dr. Frank Bell, who specializes in pediatric infectious diseases at Providence Swedish. Thank you for being here.
Thanks for the invitation.
Well, I have to ask first and foremost, so what are pediatric infectious diseases, and particularly what is important for parents to understand about them?
I think parents need to know that pediatric infectious diseases are part of life. You know, we little ones arrive without much experience of the world and all the bugs that live in this world with us. So it's really an inevitability that kids are going to pick infections up, and that's really how we build our immunity, and that's how kids get tough and strong. So the things that parents need to look out for are things that I think most people know will maybe suggest an infection. So a high fever, an illness with rash, diarrhea or vomiting, cough, respiratory difficulty, those kinds of things. So one of our important messages for parents is that use your own instincts. You can trust your instincts. If you think something is wrong, then it's time to seek advice.
I don't even know what a rash is related to, but somewhere along the way a pediatrician told me to look out for a rash. So like every time, there's a rash involved. And you know what, I think it's important to share this information. So let's talk about pediatric infectious diseases. Do they have seasonal patterns? And how can you prepare for changes in disease throughout the year?
For sure, it's the summer. We're all enjoying the chance to be out and about. Some of our winter blah is behind us, and so we have had a grim last 4 years, haven't we, with infections?
Yes.
So a lot of the respiratory viruses, cough, sneezing, and those kinds of things, we hope are a little bit gone for at least this part of the year. Summer is a time where we want to be outside, we want to be sharing food and playing in the water, and so those kinds of places are places we can catch more sort of stomach upsets and bugs. And so there are some things we can do to try and reduce that risk.
Okay, what are those things?
Well, around water, there are some instructions at most communal bathing sites. If you're out with a party and a bunch of kids and places, you can follow the instructions.
Take a shower before getting in the water.
Taking a shower before getting in the water, keep kids' diapers contained, those kinds of things. And the other fun thing about summer is eating outdoors, and some important principles about keeping food safe. We're used to a routine in our own kitchen, but if you're out on the grill and outside, important to keep meats and other vegetables separately, keep your cooked meats separately from your uncooked meats, those kinds of things.
And be careful about sharing your food, because that's how I got mono in high school. But you say that's an important thing to note. Don't share your food, really.
And if you can, hand washing and hand cleaning is really important. You could take an alcohol-based hand sanitizer out if you're at a picnic. So
good idea.
That's a great way of keeping yourself clean and preventing you from spreading things to other people in your group.
Really smart. So let's talk about vaccines, because I know a lot of parents, we are still concerned about that. So what recommendations do you have about vaccines, and what advice do you have for, the summer spike of COVID, for example?
Right. So going back to the pandemic, we got way behind, many of us, with visits to the doctor and getting up to date with vaccines. So summer is a good time. School's around the corner, even though we don't want to think about it, but getting prepared for school, thinking about vaccines your child needs. Summer's also the time for traveling, and if you're traveling internationally, some really important things that you might be exposed to, knowingly or unknowingly, if you're abroad. So really important to be up to date with measles, get your MMR, the whole family.
Yeah, whole family.
The whole family needs a measles jab.
Okay, because you need that herd immunity. Okay, so what advice do you have for managing, like let's say someone gets sick now, okay? Fever or an illness at home, what precautions could be taken to avoid maybe that sickness spreading to other kids? And also, when should you worry? Like, when is it time to call the doc?
Well, I think, again, a parent can trust their instincts. You know your child, you know when something's wrong. But if your child's sick, it's a good idea to stay home, certainly with fever and cough, diarrhea, vomiting, that kind of thing. Those things are easy to spread. So stay home with the child, find some other activities you can do at home, and wait until they're clearly improving before you're out and about and mixing with people.
Yeah.
Kids with high fevers are miserable, and that's not much fun. And you can make kids feel much more comfortable just by using a fever reducer, something like acetaminophen or ibuprofen.
And that's okay. Like my grandma's always says, the fever has to burn off. It's okay to give the acetaminophen.
Sure, I think so. But a lot of it depends on just what you think is going to make your kid feel better. There's nothing wrong with having a fever. It doesn't have to come down. But I think for most parents, having your kid with a fever that's reduced is going to make them feel much more cheerful, much more likely to get the fluids they need that we want to push them in. So it's about the comfort of your child. If it seems to help, it's a good idea. But there's no need to push the antibiotics, the fever medicines, just because there's a fever. But fever and misery, you can do something about that.
Such great advice. Thank you so much for coming by and chatting with us about this. And after the break, we are talking kids and injuries, why seeing a specialist might be the right move to get your kid back on their feet. We'll be right back.
This is New Day Northwest.
Welcome back to the show. You know, as children grow, their bones, joints, and muscles continue to develop. An injury or medical condition can cause pain and limit their activities and everyday lives. The pediatric orthopedics team at Swedish is committed to getting kids strong, active, and pain-free. And joining me now, our orthopedic surgeon, Dr. Laurel Solomon, and one of her former patients, Claire Bonaski. Thank you both for being here.
Thanks for having me.
So Claire, I'm gonna ask you first. You went to Dr. Solomon when you broke your foot, but while you were there, she found something else.
Yes.
What was it?
She found that I had a deformity in my knees called knocked knees, which caused my knees to touch and then my ankles to kind of be spread apart when I stand with my legs together.
No kidding. Yeah. And was that causing you problems?
My mom had always noticed that my feet kind of
moved in.
What was the word?
Turned in.
Turned in. Yeah. And she could tell that like I was walking funny, but I hadn't noticed much before.
Okay, so Dr. Solomon, can you explain what knocked knees is exactly and how you identified that Claire had it? I mean, it seems kind of like rare.
So it's actually not particularly rare in my world. I'm used to just looking at kids and sort of monitoring their alignment.
Yeah.
So knock knees is when if you stand with your knees touching, your ankles do not touch. And so the technical term is genu valgum, so from the Latin, so you may hear me say that, but it's sort of the opposite of bow legs.
It's the opposite, so it's going in instead of out.
Yep.
So how is it treated?
So it generally surgically.
Okay.
There's a natural progression that kids go through as they age, from bow legs when they're young, to then straight by the age of about 2 years. Then by about 3 to 4 years, they start to get that knock-kneed position. And then by 8 years old, they should get their normal adult alignment. So if they're still kind of knock-kneed over the age of 8, we start looking at maybe there's something we should do to help correct that.
Okay, so maybe there's probably a lot of adults walking around that are knock-kneed and didn't even know it. So what kind of problems happen if this isn't taken care of?
So it can certainly contribute to sort of wear and tear arthritis on the outer aspects of the knees. If you have patellar dislocation or instability, it can kind of make that worse. And it can sometimes cause some self-esteem issues.
Yeah, I would imagine. So Claire, she's talked about all the things. You went the surgical route. What was that experience like and how was recovery? And how old were you, by the way?
I think I was 11 for my first surgery and then 12 for my second.
For 2, okay, so what was that like?
It was actually fairly smooth. The surgical team was super helpful and was just incredible to work with. And so was Dr. Solomon. And then the recovery time was also pretty nice.
And then as you've grown, it's probably made her life so much easier, right?
Yeah, I think so. I mean, I was so little that I don't completely remember, but I'm grateful that I did it. And
what are you up to today? You're in college now? You're in sports?
I am in sports. I row at the University of Portland, and I'm going into my junior year there.
Right on. Good for you. If Claire's condition hadn't been found and treated, would she be able to row? Would she be doing these things she could do right now?
There's a lot of physical activity that you have to be able to do to be a collegiate level athlete. And I think it's possible. However, I think by having straighter alignment, it really helps you move through the world.
When it comes to looking for a specialist and say, you know, you're a parent, you've noticed something's wrong, like what should you look for when it's time?
So I think it's really good to use your pediatrician, your primary doctor, as an expert who knows sort of what you should look like. However, if you do notice your kids having some concern about how they're walking or how their legs look after the age of 8, I think it's worth having an evaluation.
Okay, one more time, because you know I'm going home and checking both of my children.
Yes.
If their knees touch, their feet shouldn't. Is that right?
Right.
Okay.
So they should, yes. So you should not have your feet widely spread if your knees are touching.
Copy that. Okay. Well, then we've heard it all now, and if you have any more questions, well, contact the Pediatric Orthopedics program at Swedish. Just check out the website you see right there on your screen to learn more. Thanks to both of you. We hope you enjoyed our special today. We hope you learned some stuff. Even a veteran parent like Susie can learn some stuff, right?
I did. I was kind of struck by that continuum of care thought, and I have a daughter who had a hearing loss, and when she was real little, I had to be the gopher for all the doctors, the go-between, and if we had had a team working together, it would have been a lot easier, I think.
So true. Yeah. I reminded myself that it's important to trust your gut. If you feel like something's wrong, get to the doctor. So thank you. Yeah. Thank you for producing this special.
Absolutely.
Well, I'm so glad that we've all learned a lot. Lots of changing all the time in the medical field, and we are grateful for organizations like Providence Swedish to stay on top of the latest advances in health and wellness and share it with all of us. So thanks to them, and thank you for spending time with us today. You can check our website for more of our content. You can always send us an email and share your thoughts, but most important, don't forget to enjoy your new day. We'll see you next time.
Some segments of New Day Northwest are paid for by these fine sponsors: